Hello, my name is Eduarda Naomi Núñez Félix, and now I'm going to read the unit 14 to 24. Symptom and sign, describing problem. The problems with a patient report to the doctor are called symptoms. For example, pain or nauseous. Signs are what the doctor finds, also known as findings on examining the patient, for example, high blood pressure or a rapid pulse rate. Symptoms are also known as complaint to report a patient's symptom or complaint. Doctor say, Mr. Firewood was admitted complaining of chest pain. In case not, the abbreviation is used chest pain. Presentation. Patients say they want to see the doctor. Doctor say the patient presented the symptom which cause a patient to visit a doctor or to present is called the presenting symptom, presenting complaint, or presentation. His presenting symptom. His presenting complaint was chest pain. He present to his GP with the chest pain. The use of presentation is chest pain. Now part C, talking about symptom. Symptom meaning and patient say. Tiredness, lethargy, fatigue, lassitude, meaning loss of energy. I feel tired all the time. I feel completely wore out. Lately, I have been feeling completely exhausted at the end of the day. Malaise, general feeling of being unwell. I feeling unwell. I don't feel well. I have been feeling of color for 2 days. I haven't been feeling myself for a week. I have been out of sore, sore all day. Anorexia, loss of appetite. My appetite is very full. I have been off my food for days. Weight gain, increase in weight. I have put on 8 kilos in the last year. I have gained 5 kilos. Weight loss, decrease in weight. I'm not eating any less than usual, but I have lost a lot of weight recently. Constipation, hard in frequent pieces. My emotions are very hard. I have been quiet, constipated lately. I'm not very regular. Now the exercise. Complete the table with frequency opposite. Put at the street mark in front of a street syllable in names books. The first one has been done for you. Exhaust, exhaustion, exhausted. Fatigue, fatigue. Lethargy, lethargic. Tiredness, tired. Make a word combination using a word phonetics book. Look at A, B, and C opposite to help you. Complain of color, out of sort, present with, put on, wear out. Complete the sentence with the correct form of the verb present. A 16 years old man present with a 9 months history in increasing shortness of breath. The most common presentation is the loss of cons- is loss consciousness. Cranial arteries may present as fever without any obvious causes. The patient usually presents with a severe sore throat. The presenting symptom in this patient could perhaps be due to renal failure. Other conditions with a similar presentation included acute cheilitis. Reduced growth is an important presenting complaint of celiac disease. 2 months following presentation, the patient was able to walk. See the patient describing of her symptoms, then complete the case report. Look at the opposite to help you. I was well until a few months ago. In the beginning, I just feel of color and a bit tired. But lately, I have been feeling completely wore out at the end of the day. I'm not eating any more than usually, but I have put on 9 kilos in the last year. My mentions are hard and my hair has started to fall out. Cause 13, a 50 years old housewife who had been well until 4 months previous. Complained of tiredness and malaise. She had gained 9 kilos in weight in the year before. She she presented to her GP also she dined eating more than usual. She was constipated and she noticed that her hair had started to feel odd. Below, full blood count. In the investigation of blood disease, the simplest test is a full blood count, PBC. A full blood count measures the following in a sample of blood: the amount of hemoglobin, the number of the different cells, red cells with blood cells, leukocytes, and, and platelets, thrombocytes, the volume of the cell, the erythrocyte sedimentation rate, a measurement of how quickly red blood cells fall to the bottom of a sample of blood. Anemia. Anemia is one of the commonest diseases of the blood. It may be due to bleeding, loss of blood, excessive fusion of red cells, low production, for example, because the dye is lacking or deficient in iron Pe. A medical student has examined an elderly patient with a very low level of hemoglobin and in description the case with a hair profession. What's the most likely diagnosis in the case? Student. Most probably carcinoma of the bowel with chronic blood loss. What's against Dasa's diagnosis? Well, he hasn't had any change is he in his bowel habit or lost weight. What else could you include it in the differential diagnosis of severe anemia in a man of this age? He might have leukemia of some sort or aplastic anemia, but that's rare. It will be very unusual. Another cause is iron deficiency, but he seems to have an adequate diet. Okay, now there is another cause of anemia, which I think is more likely chronic bleeding ulcer. Yes, that's right. But what about pernicious anemia? Can you explain that? Well, he's gonna of the typical neurological symptoms like para paresthesia. Pernicious anemia. Jordi Pons, the medical student from Barcelona, has made some language not in his textbook. Pernicious anemia, PA, is a condition in which there is atrophy of the gastric mucosa with, consequence failure of intrinsic factor production and vitamin B12 malabsorption. The onset is insidiously, progressively increasing symptoms of anemia. Patients are sometimes said to have a lemon yellow color owing to a combination of pallor and milk jaundice caused by excessive breakdowns of hemoglobin because of ineffective red cell production in the bone marrow. A red sword so glossitis is sometimes present. Patient present my symmetrical forested in the fingers and toes. And toes. Early loss of vibration sense and progressive weakness and ataxia the spleen may be palpable. Onset beginning. Insidious slowly develop. Color, lack of color. Meal, sleep. Jaundice, biliary anemia. Breakdown division into small parts. Bone marrow, soft tissues in the cavity of bones. Symmetrical, each side the same. Vibration sense, ability to feel vibration. Progressive, continuing to develop. Palpate can be filled with the hand. Now the exercise. Pin word in the box with opposite meaning. Look at B and C opposite to help you. Adequate, inadequate. Against, poor. Insidious, sudden. Likely, unlikely. Severe, meal. Very common. Make word combination using a word from each box. Look at B and C opposite to help you. Bone marrow, differential diagnosis, insidious onset, iron deficiency, pernicious anemia, progressively increasing, vibration sense. Complete the sentence. Look at A, B, and C opposite to help you. A 39 years old man presents with a history of progressive abdominal distension over a period of 6 months. Bleakness may be caused by vitamin deficiencies. The bleeding and purpura are caused by abnormal platelet function. The white cells count is normal, so we can exclude acute leukemia. The yellow color of her skin and conjunctive is probably due to jaundice. There was a pulpy mass in the right upper crown of the abdomen. Treatment is aimed at restoring fluid balance with adequate intravenous fluid. The anemia may be due to increased red cells breakdown. Complete the conversation. Look at the opposite to help you. Professor, what is again the diagnosis for Nation's anemia of physical examination? The problem started quiet is subtly, so it didn't have the typical insidious onset. He doesn't have any skin color and he doesn't have symmetrical porosity or absent vibration sense and I couldn't feel has explained. What about his tongue? His tongue was normal and not inflamed or sore. Buns, buns. Some common English name for buns. English name and anatomical name. Skull, cranium, jawbone, mandible, spine, vertebral column, breastbone, sternum, rib, costa, collarbone, clavicle, shoulder blade, scapula, high bone, femur, kneecap, patella, and shin bone, tibia. Fractures. A fracture is a break in a bone. Some of the different typical of fracture. Green stick displays community impacted and open compound. A pathological fracture is a fracture in a diseased bone. A pathes of a Swiss fracture is due to repair minor trauma, for example, long distance marching or running. Treatment of fracture. When the fracture of a broken bone held and joined together, the union may be promoted or helped by reducing the fracture, replacing the fragment in their anatomical position if they are displaced after reduction. Excess movement of the broken bone is prevented by physicians, either external, for example, a splint or plaster of Paris cast, or external, for example, a pin or a plate and screw. A displaced fracture with a is not reduced may result in malignant, incomplete, or incorrect union. Now the exercise. Label the diagram using words from the box. Look at A opposite to help you. 1 is skull, 2 is jawbone, 3 is spine, 4 is breastbone, 5 is rib, 6 is collarbone, 7 is shoulder blade, 8 is high bone, 9 is kneecap, and 10 is shinbone. Match the type of fracture. With the description, look at the opposite to help you. Open is there is a break in the skin. Community is C. The bone is broken into several pieces. 3 displays is D. The broken pieces are separate. Green stick 4 is B. The bone is bent is occur mainly in children. And impacted is E. The broken pieces are pushed together. Complete the textbook extract. Look at the opposite to help you. Reducing a fractures involves tying to return the bones to as near to their original position as possible. If a fracture is a owl to help in display position the fracture will unit, but it may go on to millennium. Now, childhood milestone. Childhood is the period during which a person is a child. Is a child. It ends with a probably the onset of sexual maturity. Infant is another word for young child. Infancy is a period from birth until about 5 years of age. The milestone in a child's development and the age at which they usually occurs are sitting by 9 months, crawling by 12 months, first walk by 18 months, walking by 18 months, talking 2 word sentence by 3 years. Common infections. Disease and common name. Morbillo rubella, measles, rubella, German measles, varicella, chickenpox. Infections parotitis, mumps. Pertussis, whooping cough. Acute Latin tracheitis, growth. Escalena scarlet fever. Rheumatic fever. Tetanus, gel. Poliomyelitis, polio. Celiac disease. A medical student have made some language, not while reading her textbook. Celiac disease is a disease of the small intestine caused by sensitive to gluten. It can present at any age, but in infancy is upper after raining on the cereal containing gluten. The clinical features included diarrhea, malabsorption, and failure to trip. There may be signs of malabsorption and there may be some abdominal distension. There is the loud and the loud puberly leading to short story in the adulthood. Sensitive to having negative reaction to weaning, changing the diet from milk only to solid food, clinical phases, the symptom and sign of disease, malabsorption, poor absorption, malnutrition, poor diet nutrition, adjective malnourished, try, wrong slowly, distinction, feeling, delay, lay down accept, failure, when sometimes that is accept does not happen, stay, size especially high. Now the exercise. Complete the table with word from A and C opposite. Then complete the sentence with word from the table. Verb, noun, and adjective. Delay, delay and delayed. Develop, development or develop. Distance, distinction and distance. Fail, failure and failing. Nourish, nutrition and nourishes. Number one, babies with the fetal alcohol syndrome may present with failure to thrive. Abdominal distension may be due to an enlarged liver. A small amount of alcohol in pregnancy can affect fetal development. Mortality from measles can be reduced by better nutrition. Delay in one or more of the milestones may be the first sign of disease. Complete the sentence, look at A and C opposite to help you. After sitting, babies learning to crawl and then to walk. A child who has started eating solid food has been waning. Someone who is not very tall is said to be sure. The stage in a child development are known as the milestone. A childhood is beginning to develop sexually has reached puberty. With the common English name for a disease using your medical knowledge. A large parotid gland is mons. Difficult opening the mouth is lockjaw. Rash in a large posterior occipital nose is German measles. Paroxysmal cough with vomiting is whooping cough. Papules with vesicles first on throat is chicken pox. Cough of cool followed by rash is measles. Sore throat and rash is scarlet fever. Swelling joint in her murmur is rheumatic fever. Fever followed by muscle weakness is polio. Cough with a stridor is croup. the endo the endocrine system. Excess and deficiency. An excess, too much, or deficiency, too little of circulating hormones cause a wide range of medical conditions. For example, hyperthyroidism and hypothyroidism, where there is an excess of hormones. One part of the treatment consists giving the patient some time with inhibit the production of that hormone, has in the use of